In 2020, the entire world came to a halt. Borders were sealed, schools were closed, and people were forced to stay indoors. This global disruption was caused by a disease called COVID-19. This event clearly showed how powerful diseases can be in shaping human life and society. In this video, we will understand communicable and non-communicable diseases, how they differ from each other, and why prevention and lifestyle choices play a crucial role in health. Communicable diseases are diseases that can spread from one organism to another. They are caused by microorganisms such as bacteria, viruses, fungi, and parasites. These diseases spread through close contact, contaminated food or water, air droplets, blood, body fluids, or vectors like mosquitoes. COVID-19 is a classic example of a communicable disease, as it spreads easily through close human contact. One example of a communicable disease is salmonella infection. Salmonella is a type of food poisoning caused by the bacterium Salmonella enterica. Common symptoms include vomiting, diarrhea, fever, and dehydration. It spreads mainly through contaminated food and poor hygiene. Prevention involves proper food handling and maintaining cleanliness. Treatment includes drinking plenty of fluids and antibiotics when required. Another important communicable disease is HIV, or human immunodeficiency virus. HIV attacks the immune system and weakens the body's defense against infections. If left untreated, it can progress to AIDS, which leads to severe infections and illnesses. HIV spreads through infected blood, sexual contact, and sharing contaminated needles. Prevention includes safe sexual practices, proper handling of needles, and regular testing. Treatment involves lifelong antiretroviral medicines that control the virus. HIV enters the body using special spike proteins on its surface that attach to CD4 receptors on immune cells. Once inside the cell, the virus converts its RNA into DNA and integrates it into the host genome. This forces the infected cell to produce new viruses, making HIV difficult to eliminate. Athlete's foot is another communicable disease caused by a fungus called Tinea pedis. It usually affects the skin between the toes and causes itching and white patches. It spreads through direct contact and is treated using antifungal medicines. Malaria is a communicable disease caused by a parasite transmitted by mosquitoes. It causes fever, headache, and chills. Prevention includes mosquito control measures such as nets and repellents. Treatment involves antimalarial drugs like artemisinin-based combination therapy. Tuberculosis is a communicable disease because it spreads through the air from person to person. Cancer, however, is not communicable because it does not spread between individuals. Non-communicable diseases are diseases that do not spread from one person to another. They usually develop slowly and are mainly influenced by lifestyle, diet, and genetic factors. Examples include cancer, heart disease, chronic respiratory diseases, and diabetes. Diet plays a major role in non-communicable diseases. High intake of saturated fats and poor nutrition increase disease risk. Lifestyle factors such as lack of exercise, smoking, alcohol consumption, stress, and drug use also contribute significantly. Some diseases may also be inherited due to genetic abnormalities. Cancer occurs when cells mutate and grow uncontrollably in the body. Symptoms vary depending on the organ involved and may include weight loss, bleeding, or abnormal lumps. Treatment may include surgery, chemotherapy, radiotherapy, or stem cell transplantation. Cardiovascular diseases affect the heart and blood vessels. Fatty deposits build up in artery walls, leading to high blood pressure, heart attacks, or strokes. Treatment includes medicines like aspirin and statins, and in severe cases, surgical procedures such as stent placement. Chronic respiratory diseases like asthma and COPD affect the lungs and airways. They cause difficulty in breathing, persistent cough, and reduced lung function. Treatment includes inhalers, tablets, and sometimes steroids to reduce inflammation. Diabetes is a metabolic disease that affects blood sugar levels. Symptoms include frequent urination, increased thirst, fatigue, and weight changes. Treatment includes lifestyle modification, oral medicines like metformin, and insulin therapy. The risk of non-communicable diseases can be reduced by maintaining a healthy and balanced diet, drinking enough water, exercising regularly, managing stress, and getting adequate sleep. In summary, communicable diseases spread from one organism to another and can often be prevented through hygiene, vaccination, and public health measures. Non-communicable diseases do not spread, but are strongly linked to lifestyle and genetic factors. Understanding these diseases helps us make better health choices and protect ourselves in our communities.